The broadcast is now starting. All attendees are in listen-only mode.
Hello, everyone, and welcome to today's webinar on prioritization. My name is Susan Caldero. Everyone knows me as Susie Caldero, and I'm one of your NCLEX instructors. And today I'm going to be teaching about prioritization in this webinar, and we're going to go over some strategies and some tips that's going to help you with these types of questions. Along with SATA questions, priority questions may be one of the hardest questions you will have on the NCLEX exam because many of these questions often have multiple correct answers. So it's to identify what is going to be the priority. So today we're going to go over some tips that I feel you'll find very helpful. So make sure you have a paper and pencil ready because you always want to take some notes. And here we go. So I'm going to take the camera off so you can focus on just the PowerPoint, okay? So let's get started. All right, prioritization. So when we think of prioritization, let's look at some keywords. Think about priority questions have helpful strategies that you can apply. We also want to look at, but first you must get good at recognizing priority type questions. Look at priority clues in the stem of the questions. For example, let's look at some keywords. For example, you can spot these prioritization question clues by looking at some of these examples. Which patient is a priority? A patient arrives in the emergency room. What's the most important intervention? What is the nurse's first priority? The patient arrives by ambulance. Which patient should the nurse see first? A nurse is caring for a patient after returning to the floor. Now, which of these statements would indicate that this would be a priority? Have you figured it out by now? Let's take a look. Well, guess what? They all are priority questions. Some of them are pretty straightforward because they have the word priority in them, but it could be things like initial or most important response. But look at questions like arrives by ambulance. How is that a priority question? Well, think about patients that just arrive by ambulance or arrive in the emergency room. You would imagine that these patients would take precedence and they would be a priority. So don't be fooled by just having the word priority in the stem of the questions. Think about the clues that are presented in the question. So they may all be right in priority questions. Now, technically, they could all be correct, or maybe one could be wrong and three of them correct. The idea is that you have more than one correct answer that apply to the scenario. So it's up to you to filter through and figure out which is the most important or the right answer. Prioritization questions are tricky because all answers are often correct actions. In the scenario, you may have to perform all of the actions, but these questions test your knowledge about which to perform before the others. Even if they all look proper clinical actions, one answer will take priority over the others. To determine which one, you must rely on strategies and critical thinking, not only your clinical experience. Often we look at questions and we think and go to our experiences, our background, the things that we know. And these are some of the biases that we may bring to questions. But remember that each of these priority questions is based on the source of truth that NCLEX looks at. So we'll talk more about that later. So let's talk about one of the tips that can help your strategy that would be very useful in looking at how to prioritize certain questions. See here, ABCs, what comes to your mind? So this actually stands for airway, breathing, circulation. I know you probably are used to that when you did CPR back in the day. It used to be this. Now they changed it to, what is it, CAB? But it's airway, breathing, circulation is a key into answering priority questions. Yes, in that order too. If you're trying to decide between a patient with a circulation issue and a patient with an airway issue, you guessed it, you address the airway patient first. So A before B, B before C. Look for clues or circumstances that could indicate an ABC issue. For example, these are some indications that might indicate an airway, breathing, or circulation problem, such as things like, say, patient is NPO, impaired gag reflex, dysphagia, anaphylactic reaction, asthma, COPD, abnormal heart rate or BP, fluid deficit or overload, hemorrhage, supplemental oxygen, congested heart failure, or adventitious lung sounds. Don't be fooled just because there's an ABC answer choice. When using the ABC framework, you should know airway is not always the correct answer, particularly if the question does not give you an airway problem. If airway and breathing are not the problem, then look to circulation and see if that applies. If not, look to your other prioritization strategies. Now, we're going to be practicing some questions, so this statement will become a little clearer. Right now, you're probably thinking, not sure what you mean by that. Just because an answer may say something about applying oxygen, but the stem of the question did not indicate there was a respiratory problem, and that's not the reason the patient is here. Maybe the question is asking something else. So once again, make sure that the answer applies to the question. Now, another strategy you might want to consider using is the Maslow's hierarchy of needs. According to Maslow, in a given NCLEX scenario or priority questions, the client may be visibly distraught, and one of your answer options will probably involve calming her down. That is an important as a nurse, of course, but less so than physiological. So let's take a look at Maslow's hierarchy of needs. If you recall the pyramid of Maslow's hierarchy of need, it always starts out with the foundation of physical needs. We need to deal with the physiological before we can deal with safety, love and belonging, esteem, and self-actualization. That would be the priority would be first is looking at any physiological needs before we can address some of the others. Now, every time you come across a priority question, remember that according to Maslow's hierarchy of needs, the client's physiological needs come before psychosocial needs. This is consistent with ABC rules since airway, breathing, and circulation are all physiological needs. Now, we're going to look at another tip. We're looking at the nursing process. Look at assessing the client and situation must be done first in order to plan and implement care. If you recall the nursing process, looking at assessment and intervention, and looking at planning and then evaluation, you always want to start with an assessment. You cannot treat a patient or a client if you don't first assess what are the needs. But if the question provides enough assessment information, it is now time to act. Read the stem of the question carefully to determine what you already know and be sure to understand what is being asked. In other words, if the question included something like the nurse assessed the client having abdominal pain with a set of vital signs, and you think that the assessment is included in the question, then you're looking for an implementation answer choice, something that you're going to act on. However, if the question does not include an assessment, then the information you're looking for in the answer choices would be an assessment answer. An assessment answer would be things like check vital signs or check lab work or review. These are some key words that would include doing an assessment, identify, look up lab works. Those are all parts of an assessment. The next thing is to think about as part of the nursing process is when we're going to act. Now, this is an important part because often a lot of the questions that you're going to be given in NCLEX and even through our webinars is one of the choices may be call the healthcare provider. Now, it's very tempting that when you're not sure about a question that you want to call the healthcare provider first. Some of you in where you're working in your particular area, hospital or policy of your particular area may insist that you call the physician anytime there's a patient change. But it's important to understand that part of the nursing process and before calling the physician is that we do proper assessment so we can effectively communicate with the physician the information so that he can provide the appropriate intervention. So there are some tips as to when to call the doctor. These are some things that I think you should write down. So let's talk about when to call the doctor. Remember, when you call the doctor, the first that he or she will ask is things like, what are the vital signs? What's the temp, the blood pressure, the SpO2 or heart rate? How silly would you look as an RN if you sat there, well, I don't know, doc. I just know that he's not looking good and I'm calling you. You may be completing the assessment while someone else is on the call, but unless it is a code situation, you always want to be prepared. One of the tips that has been very popular recently is using what we call SBAR. SBAR is SBAR, which stands for Situation, Background, Assessment, and Recommendation. Something that was developed by the Navy as they were communicating very urgent information. As you can imagine, if you had to be the one to push the nuclear button, you want to make sure that you're getting the information accurately, timely, and quickly. Often in nursing and in the healthcare field, when we call a physician, a lot of time is spent in providing information that's really not relevant or not important initially. So it's important to have a process when calling the doctor. For example, if you're concerned that a patient may be showing symptoms of septic shock because suddenly their temperature is higher than normal and their blood pressure is low and they're tachycardic with a high heart rate, and you want to make sure the doctor's aware of that, that's what your concern is, you don't want to start the conversation, well, hello, doctor. I'm calling you from so-and-so regarding so-and-so. This patient has not been doing well. And if you remember, he was admitted 3 days ago with pneumonia. And today, well, actually this morning, he started out with a temperature of 99, but right now he is having a temperature of 103. Could you imagine the frustration of the doctor wondering, like, get to the point? So getting to the point would mean start with the situation. Why are you calling the doctor? You're calling them because, hello, doctor, this is so-and-so from so-and-so, and I'm calling you because I'm concerned your patient in room 3308 may be showing signs of septic shock. Well, you can imagine the doctor on the other end is going to pay more closer attention to you now after you made that statement. So now you're going to back it up with what? Your background. If you recall, doctor, this is the patient that was admitted 3 days ago with pneumonia. Then your assessment. Today, he has spiked his temperature to 103.2, and his blood pressure right now currently is 90/40, and he is cold, clammy, and he has weak pulses, and his heart rate right now is 110. Okay, now you see how important it is. Recommendation, or doctor, what would you like me to do first? Would you like me to call infectious disease or hang some fluids? It's up to the doctor, then make the orders and whatever. So you always want to make sure that you're communicating effectively. So as we do that, we also have to think about when to call the doctor. As I mentioned before, creating an assessment and making sure you have the valuable information to convey the doctor is going to be important, but you also have to recognize when to call. So one of the common NCLEX traps is to give you complex situations and then contact the provider as an answer. So while this needs to be done, especially in complex settings, it might not always be the first thing a nurse should do. Okay? So how do you know when it is? Well, The only time the nurse would need to call the doctor is after an intervention has failed, or there is nothing else the nurse can do to address the situation. For example, if you've given a pain med for someone and 30 minutes later they're still complaining of very high pain, and their pain med is not due for another 3 hours, you may need to be calling the physician, okay? Because this is, they're not responding to the plan of care, and you can't do anything else unless you have further orders. Never call about something that is expected with the disease process. Be able to recognize expected signs and symptoms of disease versus signs and symptoms of potential complications. And this is going to be an important strategy that we're going to talk further in detail when we go to the webinar on select all the apply questions. And this is especially important regarding the 6 steps to question success. By now, I hope that all of you have taken the 6 Steps to Question Success webinar and understand the process of answering question using the 6-step strategies. One of them, if you recall, is step number 4, where we think about expected outcomes. Is this something that we would expect to see for a patient? Because if it is, most likely there's going to be already a plan of care. Sometimes it may look like standing orders, it could be policy orders, those kind of things that are already set in place in case of, because this is an expected outcome. You need to be able to recognize that this may be outside of what is expected. What is a change in condition? And when there is a change in condition, then this is when you may need to be calling the doctor to let him know this is an unexpected event. Right? And the other one is if you know what the patient needs based on your own assessment and critical thinking, and it's outside of your scope of practice. In other words, you know the septic patient needs IV fluids, but as a nurse, you cannot order that or order the appropriate lab. So you would need to call the physician because these are some things that we cannot do independently. Sounds easy enough, right? Okay, so we're going to go ahead and practice some questions. All right. So what I'm going to do is I'm going to show you the questions and answers, and then we're going to move on. But what I'd like for you to do is after showing you the question and answers, pause the video. So that way you have time to review the questions appropriately, apply the 6 steps, and then review each answer carefully before selecting your final answer. So if you haven't gotten that paper and pencil, make sure you pause this video right now. Go get your paper and pencil because I want you to write down these notes. In addition to writing it down to answer the webinar questions, these are very good research questions that if you struggle with the answers, this is something that you want to be able to review and evaluate after the webinar. So without further ado, are you ready for the very first question? Here we go. It says, a nurse is triaging clients following a large natural disaster. Which client should receive care first? Think about this question. What is the key word here? What is the instruction? The instruction says which client should be received care first, which is a key word for prioritization, right? So we need to prioritize the care of the patients that are in a natural disaster. Let's look at our options. Client with open forearm injury, bone protruding and finger capillary refill 2 seconds. 2. Pediatric client with 3-inch oozing laceration on the left leg. 3. Client that is 8 weeks pregnant with a partial thickness burn on the forearm. 4. Client with glass shard protruding from chest and respiratory rate of 32 breaths per minute. I'll give you a minute to pause the video and reread the question before we look at the answer choices. All right. Hopefully you've paused that and you had a moment to think about it. And now we look at the question. And the answer correct here is number 4. Client with glass shard protruding from chest and respiratory rate of 32 breaths per minute. Hopefully most of you, if not all of you, have gotten this question right. It doesn't look like it was too challenging of a question. Number 1, we see the difference. Here we can apply our ABC, our airway, breathing, and circulation strategy to determine that this is a priority, is the airway. The respiratory rate of 32 breaths per minute is kind of a key. With the chest wall integrity being damaged and breathing becoming a problem, the patient with shard glass protruding from the chest should receive care first. Now, the other client would be considered more stable and able to wait a bit longer to receive treatment. Okay? Hope you did well. You ready for another question? Here we go. Question number 2. Practice question number 2 says, a client in the emergency department reports abdominal pain and blood in the stool. The client is perspiring and appears moderately distressed. Which nursing action would be the highest priority at this point? Let's look at our answers. Number 1, document the history of symptoms. Number 2, obtain vital signs. Number 3, assess bowel sounds and abdominal tenderness. And number 4, insert a nasogastric tube and connect to low suction. I will give you a few minutes to think about this one. And make sure you pause the video so you have time to read the question and come up with the right answer. Okay, hopefully you're back and you've had time to analyze this question using the 6 steps and come up with the answer choice. So here's a question again. It's a client in the emergency department that reports abdominal pain and blood in the stool. The client is perspiring and appears moderately distressed. Which nursing action will be the highest priority at this point? So again, the question is a priority question as is indicated in the initial action here. The topic here has to do with the fact that the patient reports abdominal pain and blood in the stool. There is also signs of perspiring and appears moderately distressed. So if you're using your 6 steps, step number 4 would indicate what is going on with this patient. What do you suspect may be going on with this patient? It could be all kinds of hypotheses going on here. Patient with blood in the stool may be indicating someone who's having some kind of internal intestinal bleeding, GI bleed. All those things could come into play here. With that in mind, what is the first action, or what is one of the things that you need to know as a nurse? Here we're looking at is not an airway, breathing, circulation type question. It doesn't indicate any respiratory issues. However, we might be able to use our nursing process to help us identify what is the right answer. Since the assessment is not completed in the question, we're looking for an assessment in the answer choices. So let's take a look. Document the history of symptoms. Does that sound like an assessment answer? No. How about 2, obtain vital signs? That seems pretty logical, right? That is an assessment to assess vital signs. How about 3? Pretty straightforward, right? Assess bowel sounds and abdominal tenderness. We can keep that one too. And how about insert a nasogastric tube and connect to low suction? That's an intervention. That leaves us 2 and 3 as our choices. Now let's get back to our question. It says, which nursing action would be the highest priority? Well, if you suspect that someone is bleeding, what do you think you want to know first? Do you really want to listen to the bowel sounds first, or do you want to check the vital signs? Okay, well, let's take a look if you were right. There you go. Obtain vital signs. Note that the patient reports signs and symptoms, but it does not state that the nurse has completed an assessment. So the nurse must complete an assessment before taking action. Assessing the vital signs is part of a focus assessment, and we need to do a general admission assessment first. The patient's other symptoms may be indication of shock, which could be further determined based on obtaining the vital signs. Vital signs and tenderness assessment is part of the process, but it's not the priority at this point. And certainly the NG2 placement isn't warranted at this point and would require physician order anyways. And if the vitals support the suspicion of shock, the next step will be to address the emergency aspects of this. So as you can see, we can use some of these testing strategies and tools to help us narrow down the answer. Does that make sense? All right. Are we ready for the next question? Question number 3. A client with pulmonary edema is assessed by the nurse and found to have a decline in respiratory status. Which of the following interventions should be carried out first? All right, so our first number 1 says to notify the physician. Number 2, prepare suctioning equipment at the bedside. 3, position the client upright at 45 degrees. And 4, administer furosemide, IV stat. Go ahead and pause the video and think through the question and write down your answers. All right, let's look at this question again. Hope you're back. A client with pulmonary edema is assessed by the nurse and found to have a declined respiratory status. Which of the following interventions should be carried out first? Well, before we look at our answer choices, let's analyze this question a little bit further. We know it's a priority question because it says, what are we going to do first? Okay. We understand that the patient's topic here is pulmonary edema. And our key words here is that there's a decline in the respiratory status. So let's talk about pulmonary edema. What do we know about that? Well, if we think about pulmonary edema as fluid building up in the lungs because probably of fluid backing up, such in the case of someone with heart failure, for example. With that in mind, the patient is going to have a hard time breathing and they're going to drop their oxygen saturations and have more problems with breathing. So think about what you can do first immediately to help this patient breathe better, because really that's the goal. The goal here is to be able to prevent the patient from going into any more difficulty with breathing and assist them to be able to breathe better. So what would be the priority? Well, is it going to be to notify the physician, prepare suctioning equipment at the bedside, position the client upright at 45 degrees, or administer furosemide IV stat? Notice that all of the answer choices are intervention. And the reason for that is because the assessment was down in the question. Notice it says is assessed by the nurse. So we know the assessment is done, so we're looking for an intervention answer. Can the ABCs help us out here? Well, there's nothing here to directly indicate a respiratory intervention like airway, breathing, circulation. So what can help us to understand what needs to be done first? Do we want to notify the physician? Well, we will have to, of course. We do need to probably, and preparing suction equipment at the bedside is not even appropriate for somebody with pulmonary edema, would it? So this is something that we can eliminate. And then position the client upright at 45 degrees may actually help the patient breathe better, right? Because you're expanding their lungs and allowing them for more air exchange while perhaps getting your administration of furosemide ready and giving it as an IV stat, which would seem an appropriate medication for someone with pulmonary edema. Notice one of the things that I said here is to eliminate one of the answers, because with priority questions, a great strategy is to first eliminate answers that are not incorrect or do not fit the scenario. In this case, preparing suctioning is not appropriate. So we can eliminate that. So that leaves us the three answers. Can we position the client upright to allow for better breathing? Do we notify the physician and then administer furosemide? Yes. So the correct answer here is number 3. This position should maximize the client's respiratory excursion. This is a quick action that is autonomous nursing. The other actions may have more significant impact on the client, but will require more time to implement, and the intervening time we want to maximize respiratory excursion. So this is something that's quick, easy to do, and within the scope of practice for a nurse to do. Are we getting it yet? Is this starting to make a little bit of sense? All right, so we're learning things as we go. We've already talked about a couple of strategies we can use. Let's keep moving on. Number 4, a client with an acute arterial occlusion of the left leg undergoes an emergency embolectomy. 7 hours post-op, there is no pulse in the left foot when a Doppler ultrasound is used. The surgeon is notified and the nurse is told to prep the client for OR. The nurse enters the room to begin the prep for surgery and he states, "I will not have any more surgery." What is the most appropriate initial action for the nurse to take? 1, do you notify the nursing supervisor? 2, notify the physician immediately? 3, explain the risk of not having the surgery. 4, document the client's refusal in the nursing notes. Pause the video so you can read the question and assess the answers and write down your answers. All right, you're back. So, a client with an acute arterial occlusion of the left leg undergoes an emergency embolectomy. 7 hours post-op, there is no pulse on the left foot with a Doppler ultrasound is used. The surgeon is notified and the nurse is told to prep the client for OR. The nurse enters the room to begin prep for surgery and he states, "I will not have any more surgery." What is the most appropriate initial action for the nurse to take? All right. So here's a question that is asking about the nurse's role when it comes to patients denying or declining service. So let's take a look at our answer choices. Notify the nursing supervisor, notify the physician, explain the risks of not having the surgery, or document the client's refusal in the nursing notes. That's right, explain the risks of not having the surgery. Explaining the risks of not having the surgery. It's a non-threatening, no coercion. The key here is initial. Go back to your instruction. It is written within the nurse's scope of responsibility to explain the risks with not having the surgery. Now, I know some of you are going, what? Isn't the doctor's job to explain the surgery? Absolutely. But it is the nurse to be the advocate, to be able to reinforce, to be able to help the patient understand. So these are some things that a nurse can do is explain that, sir, without having the surgery, you do know you run the risk that you could lose your leg. And while you're having those conversations, yes, you will be calling the physician. You will then be able to notify him of the refusal and have the physician come down and explain further any questions the patient may have. But remember, you also function as a nurse advocate for the patient. So explaining the risks of not having the surgery would be the initial response by the nurse. And then you could look at doing all of the other things that are written there. which means that they're all appropriate responses. But what we'll be doing initially is the key word here. Okay? All right. Hopefully that was clear. We ready for the next question? Here we go. A client is admitted to the mental health unit with signs of hyperexcitability, increasing agitation and distractibility. Based on the assessment, which nursing intervention is the highest priority? Well, our answer choices are 1, direct the client's energy toward a planned activity. 2, use a quiet room away from the other clients. 3, be firm and direct and set rules for the client's behavior. 4, involve the client in a group counseling session. Pause the video, review the questions, answer, write down your answer. Okay, we're back. A client is admitted to the mental health unit with signs of hyperexcitability, increasing agitation, and distractibility. Based on the assessment, which nursing intervention is the highest priority? Well, in this particular question, it already told you that there's an intervention that needs to be identified. So it kind of gave us that clue. We're looking at what is the priority. Well, think about priority regarding what? Regarding a patient that's agitated, distracted, hyperexcitable. What is your biggest concern when it comes to this patient? What are you worried about? Are you just thinking about the patient? If someone is very agitated and starting to escalate, what are some of the things that come to your mind? What is your plan to be able to de-escalate this person? So 1, let's take a look. Do you want to direct the client's energy toward planned activity? If he's distracted, because he says he's distractible, it may not work. He may not be able to focus long enough to do a planned activity. Do we want to use a quiet room away from the other clients? Well, that kind of makes sense, doesn't it? Because you're thinking about it, this person is agitated and hyper. The less stimulus and the less around other people, the better. The last thing we want to do is for this person to get more excited and become violent. So staying away from other people, taking away all of the external stimulus that would make him more excited would be a proper intervention for a patient like this. Number 3 says be firm and direct and set rules for the client's behavior. Again, he's probably not going to follow the instructions if he's distracted. And he definitely will not be ready to involve the client in a group counseling session as the fear that he may be becoming more agitated. So your correct answer here is quiet room away from the other clients. See, in the immediate situation when the client is escalating behaviors, the priority is to decrease the stimuli in a quiet environment to help the client again sense of control. Trying to set rules at this point would potentially increase the client's agitation. The client will be too excited to focus and practice in a group activities. Being in groups may also escalate the clients to more agitation and even aggressive behavior. All right? Okay. Good job. So that comes to the end of our presentation about prioritization. The more you practice, the better you get. Once again, the question is looking at keywords, identifying your topic and understand what is the expected outcome. Look at your answer choices and eliminate first those answers that are not appropriate or wrong. And then with the answer choices you have left, this is where you can bring in those testing strategies to help you validate your answers, like ABCs, nursing process, or Maslow. All right. Well, with that being said, I hope you had interesting information. You've learned something today. If you still have questions regarding prioritization or you need more practice, don't forget to, reach out to your instructor and set up a coaching call if you need more help in this area. So until the next webinar, I want to say thank you for your attention. Be safe and bye.